What lessons did you learn during and after COVID that affected your practice?
So I imagine, much like everyone, it was really tough for us. And for 6 weeks, my practice was shut down. And so it gave me, like, I have a bit of a monkey mind, and I'm always thinking, whether it's conference or new products, integrating new treatments in my practice. So for 6 weeks, I was like growing a beard, had like nothing to do except try to find like PPP funds to save my practice. And what I realized was I was like more successful and busier than ever. Pro athletes, VIP, this, that. But I wasn't generating more revenue for myself and my family. I was just kind of paying off my bloated staff and all the overhead. And so it gave a pause. We went from 3 doctors down to 2 doctors. I went from a staff of 13 to 7. We created a staff bonus, much like some of the other doctors do, based on productivity, have more of a buy-in, like team feeling, kept our main best players in the practice. And then I got into Shockwave therapy, and I had had a machine for 4 years. Suddenly I had the opportunity to Zoom with doctors in Germany and UK, all around the world, and learning like, wow, like this is a biologic tool. And when patients want to be in and out of our practice post-COVID, it's really quick, it's easy, it's generally risk-free. And then Shockwave is a great kind of low-hanging fruit for your practice, where if you're a hybrid clinic and say you do like some knees and you do hyaluronic acid because it's an easy insurance-based injection, and you want to get into biologics, Shockwave is a cost-effective, inexpensive option for a patient, but it establishes the self-pay route.